Hi, my name is Sharon Parlia. Today I'm going to teach about, give a little overview about electronic medical records. This will be part one of a two-part module. So let's begin. Let's start with an overview of what an electronic medical record is. But first I want to talk about the whole industry and just make a few statements. The adoption of electronic medical records represents one of the major initiatives facing the healthcare industry today, with the federal government providing over $19 billion in funding to physicians, hospitals, and related institutions for its implementation. Beyond the typical complexities of implementing any large-scale architectural initiative, EMR presents unique challenges to information technology and medical professionals alike. Let's start with a little overview of what we're going to discuss during this course. We'd like to talk about what is an electronic medical record, what are the benefits, how it helps the providers, how it helps the patients, and some features of an EMR. I'll also be discussing OpenEMR, which I believe is a product most of you have access to. So what is an EMR or an EHR? An EMR is an electronic medical record. It's a digital version of a paper chart, as opposed to an EHR, which is an electronic health record. Either way, they both contain all of a patient's medical history and clinical data in one place. It's a great tool for a doctor to be able to see everything in one place. Other electronic means, you can maybe have patient data in one place and then have to click somewhere else for lab results or another system for radiology results, but an electronic medical record really ties it all together. It's designed to share information from all providers involved in a patient's care. Again, an EMR or EHR, we have data that is shared across visits and it's contained in one place. For example, a patient came to the hospital and all the data on that information was collected. Now the same patient's at his doctor's office, and the doctor is able to also access the same information that was collected in the hospital. For instance, medications the patient may be on, or allergies the patient reported. And also, that's the difference between technically an EMR and an EHR. An EMR is replacing a paper chart. It's one record, whereas an EHR is usually referred to as crossing across visits and across places. An EHR actually moves with a patient to other healthcare providers, hospitals, nursing homes, and specialists. For example, if a patient needs to go to an orthopedist or a cardiologist, they'll see the same information that was collected at the primary care physician's office. Now let's talk about the benefits of an EMR or an EHR. First benefit is that it can track data over time. For instance, lab results. Patient has diabetes and they need to test their glucose level, for instance. We can see from visit to visit whether their glucose levels have gone up or down, and we can do this with most lab results. Often we can graph the results as well. Two is we can identify patients who are due for screening and preventative visits. For example, a yearly mammogram test, or a flu shot, or any other type of preventative visits. The systems usually know, and can flash an alert on, when these come due. Third benefit is to monitor how patients measure up to certain parameters, such as vaccines and blood pressure readings. Once again, a very useful tool in patient care. Continuing on with the benefits of an EMR, the fourth benefit is to improve overall quality of care. The more efficient and the more detailed the information we have, the better off we are as far as quality of care and continuing quality of care for the patient. It's all about patient care. Lastly, the ability to share data. When all team members can communicate effectively and efficiently, everyone benefits. The patients benefit, the families benefit, and the providers benefit. So it's a win-win for everybody. Now let's talk about several ways an EMR benefits physicians specifically. First off, a doctor now has quick access to patient records. From inpatient, from a hospital, to their office, to remote locations. They can be home or on vacation and have the availability to view their patients' medical records. It provides more coordinated and efficient care for the patient and the physician. Another benefit is it increases and enhances the decision support. Within an EMR, you'll see clinical alerts and reminders, improved analysis and communication of patient information. They also support diagnostic and therapeutic decisions. There are built-in safeguards against potential adverse events. For instance, allergies. Maybe a patient has documented that they're allergic to penicillin. Often in the past, if this wasn't noted, it could have presented a major problem. Now, if a doctor was to order penicillin, there's a drug to allergy check done within the EMR. It would come up as a warning and thus avoid any potential adverse events that may occur. Other benefits that an EMR has to a physician are legible, complete documentation. Everything's in one place. It's easy to read. It's easy to read what others have documented. It facilitates accurate coding and billing. There's no more questions about what was written. The codes are there. It's easier for the billers to pick it up. It makes a better situation for all. Also, the interface with labs, registries, and other electronic medical records. The fact that a doctor can order a lab and then once the lab completes the test, the results can come back into the electronic medical record. So you not only have the ordering of the lab, you have the results back in the EMR as well, and these can be tracked, as I mentioned before, over time and graphed, and it gives a good picture of the patient. Also, we have safer, more reliable prescribing. Remember the old days when a doctor would handwrite a prescription. It was illegible most of the time. It was hard for the pharmacies to read it. You could lose the paper. Now, most EMRs support electronic prescribing, where it's a prescription is entered into the EMR. They can be printed out, but more likely they're sent over electronically right to the pharmacy. So all you have to do is show up at the pharmacy and pick up your prescription. Last thing I want to mention is performance improving tools. You have real-time reporting. Everything is accurate, it's up to date, it's not outdated, it's real-time data. Now let's talk about how the EMR benefits patients. First of all, Let's talk about the reduce for the need to fill out the same forms at each office visit. How many times do you go to a doctor and you have to fill out the same form that you filled out in a hospital or you filled out at another doctor's office? They can go on for pages and pages. Now, with the sharing of data, once the data is entered into the system, and often this is done by somebody typing the information in as you're speaking the information, kind of like a question and answer session, the information's there. The basic information, name, address, date of birth, insurance, all those questions that come with seeing a doctor for the first time. Another benefit is reliable point-of-care information and reminders notifying providers of important health interventions. Again, we go back to the alerts, and notifying and what information needs to be shared and told to both the patient and the providers. And lastly, as I alluded to in my previous slide, the convenience of e-prescribing. Having a prescription electronically sent to a pharmacy, it takes a few steps out of the process. Now all you have to do is show up at the pharmacy that you told the doctor's office where you wanted the prescription sent to. Very easy. No more going there, handing them the prescription. The pharmacist can't read it. They have to call the doctor, verify. You have to wait. Now you just show up and it hopefully is ready and waiting for you. Continuing on with the benefits of an EMR to the patients is the patient portal. This is a great tool that's now being seen in many practices where the patients themselves can go online and interact with the providers. They can see their own results, they can see documentation, they can send messages, almost like an email to the doctor, communicate that way. It's a great tool, and it gives the patients much more access to their data and their information. Lastly, I want to mention referrals. Now we can have electronic referrals. Maybe you went to see your primary care physician, but your knee hurts, and now you need to go to an orthopedist. This can all be done online. Through the EMR, the primary care physician can send over a referral to the orthopedist with all your information, access to all your information, and also help schedule an appointment with them. Whereas in the past, you might have been told, you need to go see this doctor, and they would write you a prescription, and you'd have to call them on your own and figure it out and how to get there and bring all your information and get there and fill out all the paperwork once again. So it's a real streamlined process for everybody, especially the patient. Lastly, for this module, I just want to highlight some of the features of an EMR. First, patient demographics. Secondly, patient scheduling, clinical documentation, orders and results. It's, like I said before, a one-stop and shop place for all information that is beneficial to both providers, caregivers, patients, everyone. Finishing off on the features of an EMR are e-prescribing, which I've already described several times, medical billing. Now it helps with billing. Charges can just be dropped to the bill. Clinical decisions, with all the interactive checking that goes on, it's easier for doctors to make clearer diagnosis. Patient portal, which I just mentioned as well, a way for doctors and patients to communicate. And reporting. It's always beneficial to all when reports can be derived from data taken in the electronic medical record. Thank you for staying with me during this module.